With springtime comes ticks, and with ticks comes the specter of Lyme and other diseases. With their numbers on the rise this year, what can be done to protect us from these disease-carrying little creepy crawlies? Dr. Lou Durkin from Emergency Medicine at Mercy Medical Center joined me in the studio to discuss.
We're definitely more vigilant about diagnosing it medically, and we probably find it sooner and more often than we would have. But the incidence depends on the year, depends on the weather, depends on the number of ticks that have Lyme that people can be exposed to. For instance, this year we're expecting it to be a pretty bad tick season, therefore a pretty bad Lyme season, because the winter was relatively mild, It was very wet. We're going to see a lot of ticks.
And we're already, I hike all the time. I'm already seeing more ticks out there, as in you come in with the dog and the dog is, has 4 or 5 ticks on him just from an hour-long hike.
Right.
And so you're hearing that from people already.
Yes.
In terms of, we'll talk about prevention, we'll talk about treatment in a minute, but let's talk about prevention first. How should people be heading out into the woods?
Ideally, long clothing's best. And be smart and protect yourself. So insect repellent does work. Nothing's 100%, but it certainly reduces the risk of ticks being able to attach themselves. The other thing that does work but isn't as commonly used is an insecticide called Permethrin. It's over the counter, and you can find it in the drugstore if you treat your clothing with that.
That's the clothing only,
Just
though, right?
the clothing, not for the skin. Treat your clothing with that, and use DEET for skin and clothing.
And when you say insect repellent, you're making sure that the repellent does have DEET in it.
DEET is the only one that's actually been proven to work. There are a lot of other insect repellents, a lot of all-natural insect repellents, and they may work, but we don't know.
Yeah, because
DEET, we do know works.
Sometimes people are reluctant to use DEET, but you're saying in this instance, probably the lesser of two evils as opposed to getting bitten by a tick and coming down with Lyme disease?
Correct. It's risk versus benefit. DEET is actually pretty safe, but I do understand why people are a little reluctant to use it, but especially in New England, the risk of Lyme disease is very high. So the risk to DEET is very low, very comparatively.
And I know that there are several diseases that ticks actually do carry, but is Lyme disease at this point the one that you're most concerned about, and why, if so?
Yes. Well, in New England especially, that is the number one tick-borne illness by orders of magnitude. There are a few other tick-borne illnesses that we see. Rocky Mountain spotted fever is not just in the Rocky Mountains, or ehrlichiosis, and we usually find those when we're looking for Lyme disease.
In terms of what Lyme disease actually physically does to the body, what are the impacts of it?
So it depends on how advanced it is. It's actually sometimes difficult to diagnose because it can have a myriad of fairly vague symptoms, especially in the beginning. Classically, after a tick bite, the patient would get a rash that's described as a bullseye.
We've seen that, the red circle around what would be the center, right?
Correct. Yeah, the center is usually normal skin color, but then there's a red area around it, and that sort of expands and moves. The medical term is erythema migrans because it's red and it moves. That can sometimes travel to other parts of the body, but it's usually fairly asymptomatic, usually not very itchy or painful, so oftentimes it'll go unnoticed. Later on, you'll start getting more systemic symptoms, some headaches, some fatigue, eventually some joint pain. And then it's a little more advanced. It can cause issues with the brain, issues with the heart, if it goes untreated and undiagnosed for a long period of time.
So if someone actually finds a tick on them, what's the best way to remove that tick? I know it's sometimes uncommon to actually see the tick on you.
Right. The ideal way is with tweezers, or there's actually tick-removing devices out there. But the ideal is you get as close to the skin as possible, as close to the head of the tick, which is the part that's embedded.
The annoying part that's digging right in there that makes everyone incredibly grossed out by these things.
Yeah, exactly. And pull just on that part and pull up, don't twist. And then when you do remove the tick, destroy the tick.
Yeah. And if you feel like you have been bitten by a tick, is it important to go ahead and go to the emergency room, seek medical attention, or should you wait it out a little while? What's the best way to deal with that?
Don't wait it out. You should seek emergency attention, and it depends on the availability of your private doctor versus the emergency department. Most of the time, it's not necessarily emergency treatment, but it should be treated within 72 hours of removing the tick.
And why is that?
The sooner you treat with antibiotics, oftentimes you can treat with just one dose and be done.
And then you don't have to worry about those
You don't have to
longer,
worry about
lingering symptoms.
all those other things that we just talked about.
In terms of an age population that's more susceptible to this, do you have to be more concerned about the impacts that this might have for younger children or older adults, or does everybody get attacked the same way by this?
Well, it's an equal opportunity infection, and it certainly affects everybody in different ways depending on how susceptible you are. The very frail, the very elderly, and the very young are going to be the most at risk, but anybody can get Lyme disease.
And then in terms of once you've gone out into the woods and you've gone for a hike, you might be concerned that there could be ticks. But are you now seeing people report about, I've been in my backyard and this is a problem, or just, less places that you might be less likely to think that you would come in with a tick?
Right. And it's a problem everywhere in New England. It's not just the in the woods kind of a exposure. That's the highest risk is in the woods, and the second highest risk is on the edge of the woods, so sort of where the trees stop. But ticks can hang out in bushes, shrubs, your own trees in your backyard, and even the lawn. The lawn's the least populated area, but they can live there. The other thing we see is pets. If you have indoor-outdoor pets, you have tick exposure.
And you have to be concerned about making sure that you're checking them daily. I mean, my own dog, 3 times a day I'm checking the dog, and I've found them on him
already
on him, and they're biting him, and it's not a pleasant experience.
No.
Because then you're thinking about also, does it then fall off, and then it could expose a human, right? So it's actually pretty serious.
Correct.
In addition to possibly making the animal sick too.
Correct. Yeah, so if they do have a significant tick exposure, you want to talk to your vet.
Are there other insects at this time of year that you want people to be aware of that they should be, watching out for?
Ticks are the number one we worry about, but any other biting insects, they all potentially can carry different types of diseases. So we talk about mosquitoes, Zika virus, mostly out of the south, but
you've heard about that less recently, but it's still out there and a problem. Something people should be aware of.
Yeah. In general, if it bites you, it can probably transmit disease, but some are higher risk than others.
Great. Dr. Durkin, thanks for coming in today.
Thank you very much for having me.